Hey guys, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills, and I focus on gynecomastia surgery. And I'm back again with another case study on a gynecomastia patient. So I chose this case because of three main things. He lost a lot of weight, he had prior surgery, and that involved pec implants. So let's go in and look at the photo of the before and what I kind of saw when I first saw him. So as I mentioned before, this guy lost about 160 pounds years ago, went to another surgeon. Obviously at that time he had gynecomastia as well, had surgery with removal of some tissue, maybe some liposuction, but instead of treating the loose skin that the guy had, the surgeon elected to put in these big pec implants to try and lift the skin and the nipples, and that never works. You can't just put in big implants to cause the nipples to go up. You got to treat that by directly moving up. So when you look at these photos here, you can clearly see that he's got some loose skin down in this area here. And not just that, his nipples and areolas, they are not in the right position. You can actually see the contour of his pec here coming like this, and his nipple is actually below that line. Not only that, the areola is too big, and half of that areola is also not even on his chest. It's actually sitting on his upper belly. So that is my analysis, that this guy may have had a grade 4 gynecomastia before his first surgery, but it was treated the wrong way. Instead of putting in these big implants, the surgeon should have done the correct procedure, which was to address the loose skin and the nipple position and the areola size. And so that's what I did with his surgery. So here's another angle. This is the oblique angle, and you can see again, this loose skin right there is the main problem, and it extends to the nipple, and you can see the nipple actually should be somewhere up here above the lower border of the pec muscle. And so I have to address that in a way that's going to not only move the nipple up, but also place that scar in an aesthetic position. I don't want to just put a big scar on him going down this way to cut this skin out. I want to try and get that scar to kind of go up under his pec so it hides and camouflages better. And so let me show you again from the side view. Again, this is his pec here. His nipple should be somewhere right there, above the pec, facing forward, not looking down at his shoes. So that was the objective of the surgery, to reduce the areola size, to move the areolas up to the normal position, and to get rid of all that loose skin. So here we are now, 6 months later after the surgery. What I did in this case was I removed his areolas, made them a smaller size, put them in a more normal location, and then removed all that extra skin. And what you can see now on the front view, as I zoom in here, that scar is now underneath the pec right there. And what that does is not only lifts that skin up, but it also avoids this scar going onto his side chest. And that was really important to me, to make sure I place that scar as aesthetically pleasing as possible. Now, he's only 6 months out. The scar is going to continue to fade in color over the next year, year and a half, but you can already see the improvement from the before, not only in the shape of his chest, but look at the areola. It's 4 times smaller. It's a normal size now. And not just that, instead of being here lined up with where his tattoo is on this side right there, it's now right there, much higher, about 5 inches higher where it should be. And so these are the things that he needed in the first place, not just to put a big pec implant. Now he still has the implant, but now the skin tone looks much better. The nipple position's in the right height. You can see on the oblique view now, instead of the nipples looking down to the floor, they're looking up, and that's really where they should be. Again, the scar, minimal incision, ends right about there, under the pec right there, and look how nicely the skin is cleaned up from the before. You've got this fold of skin right there, and now on the after, that fold is gone. It's been completely addressed by taking that skin out. And I could have done it in a way to give him a final scar that went this way and taken that skin out, but I wanted to go on the underside of the pec, and I was able to do that really nicely. And again, here from the side view here, you can see where that nipple is compared to the before. Here, it's on this part of his arm. Here, it's on this part of his arm. So this is a noticeable increase in the height of the nipple to the normal location. And again, the loose skin on the side has been completely addressed. And so this is a great demonstration of having the right surgical plan and executing it properly gives you the right result. And this guy's thrilled. He had actually a tummy tuck 10 years ago as well, and now his chest matches his belly. And so you can see now everything is in harmony. He's gonna do great. Those scars are gonna continue to fade, and he's gonna do fantastic. So this was a complicated case because this patient didn't have the straightforward grade 4 gynecomastia look. He'd had prior surgery, he had a pec implant under his pec muscles, and so I had to come up with the proper plan and proper execution to get him the result that now makes his chest match the rest of his body. And so I hope this was helpful for you guys to kind of see how I analyze chests and come up with a surgical plan. And if you like this kind of content, be sure to subscribe, and I'll see you guys later. Till next time.